Okay, good afternoon. So today we're going to deal with another system, and this lasts only for this lecture, the urinary system. So here you have a virtual lab video for the urinary system, and there is some self-assessment PowerPoint presentation questions. This is the urinary system. It consists of the kidneys, ureters, urinary bladder, and urethra. Please differentiate between the ureter and the urethra. The ureter is between the kidney and the urinary bladder. We have two ureters, and the urethra is the tube between the urinary bladder and the outside, the external urethral meatus, what we call it. So urine flows from the kidney down the ureter, and then to the bladder, where it's going to be stored, and then to the urethra, where it's going to be excreted to the outside. So in that case, if we are held upside down, could the urine reach the urethra or the bladder? If we are hanging upside down, yes, of course. So how come? Smooth muscle peristalsis. It's not a matter of gravity. It's not a matter of gravity. Okay, so what about you are sleeping at night? You're not going to urinate after that if you are horizontally lying? No, it's not like that. Urine will not collect in your kidney. There's always peristalsis smooth muscle fibers that will squeeze the drops of urine down to the urinary bladder. And we will see that when we study the histology of the ureter. These are the functions of the urinary system. It filters the blood, and return most of the water and solutes to the bloodstream. You will see that about 180 liters of blood are going to be filtered in the kidney each day, and then most of that is going to be reabsorbed. What we are going to excrete per day is like maybe 2 or 2.5 liters of urine, but 180 liters of urine of plasma are filtered. And the kidneys, they regulate the composition of blood while they are filtering and reabsorbing the filtered material. They regulate the blood volume, blood pressure, and they produce some hormones. Probably you have heard of the hormone erythropoietin, which stimulates the production of red blood cells. We mentioned that when we were dealing with the blood. And also has another hormone, calcitriol, which is related to calcium metabolism. And it excretes waste and foreign substances. I'm not going to focus a lot about the functions of the kidney. This is more of physiology than anatomy. But you should have an idea about what the kidney generally does, so that you understand why the kidney is structured like that. Then you have the ureters, which transport urine from the kidney to the urinary bladder. And the bladder here, the urinary bladder here, is not like the gallbladder. It just stores the urine. There's no more concentration. After the urine or the filtrate leaves the kidney, there's no more concentration or change in the composition of urine. And then urethra, which discharges urine outside. So this is the kidney. You can see it. It's kidney. It's V-shaped structures. You have one on the right, one on the left. It's so obvious that the right kidney is located at a lower level than the left kidney, and this is understood because of the presence of the very bulky organ here, that is the liver, which is located in the right hypochondrium. So it pushes the right kidney a little bit below, and at the same time, this is the reason why the right dome of the diaphragm is a little higher than the left dome of the diaphragm. Related to the kidney, we have studied that before, is the suprarenal or the adrenal glands to the superior pole of each kidney. Posteriorly, the kidneys are protected by some ribs, lower ribs, the 11 and 12 ribs, they protect the kidney. And regarding the peritoneum, those kidneys are just plastered to the posterior abdominal wall. They are covered by peritoneum from the front only. They do not hang by like a mesentery or omentum, like we mentioned about some parts of the gastrointestinal tract. They are retroperitoneal. They are located behind the peritoneum together with the ureters. The kidney has a hilum, like many other viscera we mentioned. Hilum of the lung, hilum of the liver, hilum of the spleen. The hilum is where structures pass in and out of an organ. So here's the hilum of the kidney. It is located on the medial side of the bean. And it is here where The main structures that pass are a renal artery, a renal vein, and a ureter. So these are the three main structures. There are other structures, but these are the three main structures which are present. There are nerves, there are lymphatics, but the main structures are the renal artery, renal vein, and the ureter. The kidney, this is a coronal section. See here? This is a coronal frontal section. You can see the liver, and you can see the kidney here plastered to the posterior abdominal wall. It is surrounded by a capsule of connective tissue, renal capsule. And then after that, outside the capsule, you can see there is a lot of adipose tissue. For protection of the kidney, there is a lot of adipose tissue consisting an adipose capsule. And then there is another fascia of connective tissue, dense, irregular connective tissue called the renal fascia. So there is a renal capsule which is immediately surrounding the kidney and then surrounded by fat and surrounded by renal fascia. This is a longitudinal section in the kidney, and look at the hilum of the kidney. This hilum of the kidney is occupied, as I said, by the renal artery, renal vein, and that's the beginning of the ureter. It's called the pelvis of the ureter, a little bit distended, but anyway, it's a ureter. And you can see here, look at this. This is the fat, and this fat is actually surrounding the kidney, and then part of this fat passes through the hilum of the kidney into the spaces that are present in the kidney. So like, for example, this space here, this space here, this space there. Collectively, these spaces are called the renal sinus, and they are stuffed with fat. And this fat comes from outside the kidney, the fat that surrounds the kidney. Now, the parenchyma of the kidney consists of two parts. The outer part here is the cortex. As the name indicates, cortex means it's at the outside. So the renal cortex is located outside. And then we have the medulla. These dark colored structures here, they are pyramidal in shape, conical in shape, but better to remember them as pyramidal because they are actually called the renal pyramids. So these are called the renal pyramids, or they constitute the renal medulla. And in between the renal pyramids, the light colored staining structures, they are extensions of the cortex, and they are called the renal columns. They are not part of the medulla. The medulla is confined to these pyramids, and these are part of the cortex as well, called renal columns. The tip of each of these pyramids is called a papilla, renal papilla, they call it, renal papilla. And you expect that at the tip of the papilla, if this is the papilla, how it looks like, there are multiple openings of collecting ducts, and they are dribbling urine, small tiny drops of urine. They come from the renal papilla. You can see here, this is the collecting duct, and then becomes papillary duct, they call it, and urine will go into the what we call the drainage system now. It is no more parenchyma. So the drainage system of the kidney, and this is represented by all these yellow structures. So we have here, one of the beginning of the drainage system is a small cup, minor calyx, a small cup. This is another small cup, another minor calyx, and another third minor calyx. So 3 calyces, minor calyces, usually 2 to 3 calyces. They join together to form a larger cup, which is a major calyx. And then 2 to 3 major calyces, they join together to form this, what we call the pelvis of the ureter, distended part of the ureter. Pelvis means like basin, so it's pelvis of the ureter, and then it's going to narrow down here to form the ureter. So this is the drainage system of the kidney. Drops of urine are coming from the nephron, from the collecting duct into the minor calyx, then major calyx, then pelvis of the ureter, or you can say pelvis of the kidney, it's up to you, and then to the ureter. That's the sequence of events in the drainage system. Here, these structures, all these yellow colored structures, they are lined with transitional epithelium. Remember transitional epithelium, the epithelium that changes its shape of the superficial cells according to distension. It is a stratified epithelium, and so there is no absorption taking place here. It just allows distension. So once the urine, the drop of urine, is in the drainage system, that's it. It's not going to, the consistency or the contents are not going to change. They will pass through the drainage system, through the ureter, through the urinary bladder, just for storage. No more changes taking place in the urine, in the drainage system. So you can see here, this is an actual kidney. It has been dissected. You can see the tributaries of the renal vein, the branching pattern of the artery. Look at the calyces here, minor calyx, and then major calyx, another major calyx, the renal pelvis, and then the ureter. All this space actually is stuffed with what? Fat, which comes from outside the kidney. It acts like a pillow, protecting the kidney, keeping the kidney in its place, because it's not suspended by mesentery. It's kept in its place by the surrounding fat. Sometimes in some people who lose their weight rapidly, this fat is going to be rapidly lost, and the patient might develop a condition which is called nephroptosis. Ptosis means drooping down. So the kidney drops down a little bit. It's not in its actual normal position because of the rapid loss of the surrounding fat. Now, this is the nephron. It's the functional unit of the kidney. It's a nephron. We have about 1 million of these nephrons per kidney, and the nephron is composed of a corpuscle and a tubule. This is all of it is a tubule. The tubule leads into a collecting duct and then to a papillary duct. The papillary duct opens at the tip of the renal papilla. The renal corpuscle is the site where the plasma filtration takes place. So you can see here the corpuscle consists of a ball of capillaries, network of capillaries called glomerulus. And then it is surrounded by a cup, which is called the Bowman's capsule. So this cup here is called Bowman's capsule. The plasma is filtered, and this is the beginning of urine starting here in the Bowman's capsule. And then it will pass throughout the entire length of this tube. Parts of the tube, the beginning part is long, and it is folded on itself. It is convoluted, so it's a convoluted tubule, because we have two locations where we have a convoluted tubule, one at the beginning, so it's called proximal convoluted tubule, and then the other one here is called the distal convoluted tubule, and in between them there is a U-shaped loop called loop of Henle. This is the loop. It has a thick and thin segments, and then they open into a collecting duct. You can see here, this is an opening of another nephron. This is an opening of another nephron, opening of another nephron. So collecting duct, and these collecting ducts will be present here. You can see it here. This is a collecting duct. It is in the medulla and will enlarge in size, form a papillary duct, and opens at the tip of the renal papilla. The glomerulus is always present, the glomerulus and the convoluted tubule. Just imagine that this is the pyramid of the medulla. And now you can see what are the structures that are located in the pyramid. They are the loop of Henle, the collecting ducts and papillary ducts. But the glomerulus, the proximal convoluted tubule, and the distal convoluted tubule are all in the cortex. That's the difference between the cortex and medulla. It's the same nephron, same functional unit, but in two different locations. This is the glomerulus. You can see it here. It's a capillary, a ball of capillaries, and it starts as an afferent, and then efferent arteriole. Remember the vascular system? We have arteries, arterioles, and then capillaries. So that's why we have an afferent arteriole and then a capillary, but not a vein. Now we have another arteriole. It's kind of another portal circulation, a very small portal circulation. Now look at the afferent artery here. Look at the size of the afferent artery and compare it to the size of the efferent artery. Are they equal in size or not? There's some difference between them. The afferent artery is wider than the efferent artery. So this means that there will be more pressure on the blood in the glomerulus. There's high pressure because more blood is reaching the glomerulus than the blood is leaving the glomerulus, according to the diameter of the arterioles. And that's why filtration takes place. Remember the first lecture we mentioned about filtration? We said how difference between filtration and diffusion. Diffusion is related to concentration gradient, but filtration is a matter of pressure gradient. So the blood inside the capillaries is under high pressure. That's why most of the blood is going to be filtered. The plasma of the blood, not the cells, but the plasma of the blood, most of the plasma is going to be filtered, and they are going to be filtered in this cup, okay, in the Bowman's capsule. So the Bowman's capsule here, it has two layers. It has this layer here, the parietal layer, which is, as you see, it is composed of flattened epithelial cells, called the parietal layer of the Bowman's capsule. And then the visceral layer, these are the yellow cells here that surround the capillaries of the glomerulus. And these cells, as you can see them, they are so characteristic. They have multiple processes, foot-like processes called pedicles. So these cells are called podocytes. Site is a cell, podo, pedicle, foot, the cell with multiple feet, podocytes. They are actually part of the Bowman's capsule. And the fluid will be filtered into the cavity or the space of the Bowman's capsule. This is a light microscopic view. You cannot see all these details here, but again, you can see that there is a little space here between the capillaries. Look at the blood cells, multiple blood cells here. This is the Bowman's capsule, and this is the parietal layer, which is simple squamous epithelium. And then from this capsule, the tubule will start as a proximal convoluted tubule. Again, look at the afferent arteriole, look at the efferent arteriole. It's a little bit narrower. The efferent is a little bit narrower than the afferent arteriole, creating more pressure here. And so there will be diffusion or filtration. Filtration, okay. So we have a glomerular filtration, 180 liters per day, enhanced by the thinness of the filtration membrane, by the pressure, the difference in capillary pressure, as I mentioned. I'm not going to go into that again. Then we have 99% of this should be absorbed. And just to give you an indication, 75% of this 99, let's say, is going to take place in the proximal convoluted tubule. And then after that, some of the substances are not everything is reabsorbed, of course, but there are some substances are going to be secreted, like toxic material, urea, they are going to be secreted. So in the tubule, there is filtration, there is reabsorption, and there is secretion as well. This is again to show you the podocytes, and you can see here, this yellow structure, which has multiple pores. Actually, it is the endothelial cells of the capillaries of the glomerulus. They are fenestrated. Remember, we have fenestrated continuous capillaries and sinusoids. So these are fenestrated capillaries, and these fenestrations are so big that they can allow everything to pass through them except blood cells. So all constituents of plasma, including the large protein molecules, they can pass. And then some of them will be trapped here in this basement membrane. These are the large protein molecules are going to be trapped here. And then between the pedicles, these pedicles, they interdigitate between each other like this. And so they create slits called filtration slits in between them. These slits are tiny slits, and they only allow small particles to pass through them. The medium-sized particles will not be able to pass, and by this way they are returned back. The proteins will be returned back. Only the small, tiny particles will pass. So this is what we call filtration membrane. Partly it is called by the sieve of the fenestrated endothelium, then the basement membrane, and then the slit pores which are present between the pedicles of the podocytes. If this system becomes pathological, like in a condition which is called glomerulonephritis, inflammation of the glomerulus, then you would expect that the patient will present with hematuria, because even red blood cells can leak and will be excreted in the urine. So there will be the urine will become red-colored urine or pinkish in color. And the patient with time is going to lose proteins. So there will be puffiness of the face and edema because of the reduced amount of protein. So it is this filtration membrane that protects us from losing these, from losing the RBCs, from losing the proteins. Otherwise, everything is filtered to be reabsorbed back, mainly in the proximal convoluted tubule. That's why in the proximal convoluted tubule, you need a very efficient system for reabsorption. You need a large surface area, in other words, for reabsorption. And this large surface area is first provided by the length of the proximal convoluted tubule. So you can see here that even in diagrams, you will find that the proximal convoluted tubule is always sketched as longer than the distal convoluted tubule, and this is the actual case. And in addition to that, the lining epithelium. What do you expect the lining epithelium of the proximal convoluted tubule to be in order to increase the efficiency of reabsorption? This is the cell, the apical surface of the cell, and you will have microvilli. Remember the enterocytes in the small intestine, which have microvilli, which create the brush border? It's the same situation here. They have a lot of microvilli and a brush border. This is not seen in the distal convoluted tubule. And then we have the loop of Henle. They are cuboidal cells. Again, they are cuboidal cells in the distal convoluted tubule, simple cuboidal epithelium, and in the thin part, it is simple squamous epithelium. But remember always that the cells with the microvilli are present in the proximal convoluted tubule. The cells of the collecting duct here, they have a special feature. Of course, you cannot see that in conventional histological stains, like in H&E, hematoxylin and eosine stains, but they have receptors for hormones, like aldosterone and antidiuretic hormone, because these hormones also can control the amount of urine that's going to be excreted, and this control will take place in the collecting tubule, the distal part of the nephron and the collecting tubule. What is the antidiuretic hormone? Have you heard of this hormone before? Which gland secretes the antidiuretic hormone? It is the pituitary. Which part of the pituitary? Good. The posterior pituitary. So it is released from the posterior pituitary, but it is secreted from the hypothalamus. And okay. What about aldosterone? Have we studied aldosterone before? No. Yes or no? Aldosterone. Suprarenal gland. It has a cortex and medulla, and the cortex has 3 layers. Okay, 3 zones. Zona glomerulosa, reticularis, and fasciculata, and they deal with 3 S's in the body: salt, sugar, and sex. The salt is controlled by aldosterone. So aldosterone is, so when aldosterone is secreted, then there will be reabsorption of more salt from the collecting duct. And then as the salt is reabsorbed, it's going to draw with it water. And this will increase the volume of blood. Okay, so this will increase the blood pressure. We have one structure here in the kidney, which is called the juxtaglomerular apparatus. Juxta means close to the glomerulus. So it consists of 2 parts. First part, it is a modification in some, not all, some of the afferent arterioles of the glomerulus. And this is what we call the juxtaglomerular cells. The smooth muscle fibers here, they can secrete a hormone. And then we have another modification in the distal convoluted tubule. They come close together, and that's it's called the juxtaglomerular apparatus, close to the glomerulus. And this is, you can see that the cells, instead of being cuboidal, they will become a little bit columnar, a little bit thick. And that's why it's called the macula densa. The macula densa. These cells are actually, they are chemoreceptors in the distal convoluted tubule, and they will sense the consistency of urine. If it is so diluted or if it's concentrated, they are chemoreceptors. While these cells, the smooth muscle cells, the juxtaglomerular cells they are baroreceptors. They sense the blood pressure. So if the blood pressure is reduced in the afferent arteriole, which means that it is reduced in the body, if it is less, then what's going to happen? The juxtaglomerular cells are secreting a hormone which is called renin. Renin acts on a substance secreted by the liver called angiotensinogen, converted into angiotensin 1, and then angiotensin 2 converted into the kidney. This angiotensin 2 causes vasoconstriction. So vasoconstriction elevates the blood pressure. At the same time, angiotensin 2 acts on the suprarenal gland and produces aldosterone. And aldosterone acts on the tubule of the kidney, collecting tubule, causing more reabsorption of salt, more water, so the volume of blood increases. And this further raises the blood pressure. There's narrowing of the vessels, and there is more volume of blood. And that's how the blood pressure is controlled by renin that is secreted by the juxtaglomerular cells of the juxtaglomerular apparatus of the kidney. The efferent arteriole here that comes from the glomerulus again will form another capillary network. That's why I said it's a kind of portal circulation. There are capillaries here, and there are capillaries around the loop of Henle, around the proximal and distal convoluted tubules. These capillaries here around the loop of Henle are more or less, they are straight vessels, so that's why they call them vasa recta. Rectum means straight. Some of the nephrons are mainly located in the peripheral part of the, actually this is most of the nephrons. The glomerulus is located in the outer part of the cortex. Okay, there are 80 to 85% of them, and so they will have a short loop of Henle. It doesn't dip that much into the medulla. This is the pyramid of the medulla. Look at the papilla here, and look at the multiple openings of the papillary ducts that open at the tip of it. You can expect here, what is this? That is a minor calyx to receive, a small cup to receive the dripping urine. See, this is the drop. And the other type of nephron is called juxtamedullary nephron. Don't confuse these two terms. There's juxtaglomerular apparatus near the glomerulus, and there is a juxtamedullary nephron, which means that its corpuscle is close to the medulla, and this nephron is not that common, but it has a very long loop of Henle that dips into the medulla. Okay, probably in the physiology, they will concentrate more on the difference in function of each. You see here, I just mentioned enable excretion of very concentrated urine. But how? This is what the physiologist is going to tell you. Now, the ureters. We are done with the kidneys. Now, let's follow the drop of urine into the ureter. It extends from the renal pelvis and goes into the urinary bladder. This is very interesting here, that the ureter, as it enters the wall of the urinary bladder, it doesn't enter it straight, in a straight way, like that. No, it has a course inside the wall. They call it intramural course. Means a course inside the wall, intramural. So it enters it obliquely. And this is makes it easy for the smooth muscle, which are present in the wall of the urinary bladder, to act as a valve to prevent reflux of urine back into the ureter. Why? Because once the bladder contracts, then it's going to close the ureter. So the urine cannot pass up into the ureter. It has only one way to pass, and that is through the urethra. This is how the ureter looks like. Looks like the lumen of the ureter is like star-shaped. You can see the lining, transitional epithelium. The cells here, they are like cuboidal or umbrella-like cells. Sometimes they describe them. When the structure gets stretched, distended, they will become like squamous epithelial cells. So that's why they are called transitional epithelium. They change their shape, and sometimes they call this epithelium, what is the other name of this epithelium? Because this epithelium is exclusive to the urinary system. You'll not find it elsewhere. So they call it urothelium. Okay. Okay, so it's like you call respiratory epithelium is the pseudostratified columnar ciliated epithelium. This one is exclusive for the urinary system, so it's also called urothelium. And then we have this muscularis layer, which is responsible for the peristalsis. Again, we have circular and longitudinal muscle fibers, and then there is an adventitia of loose connective tissue containing nerves and vessels. Okay, And this is the urinary bladder. Look at the urinary bladder. We are going to concentrate more on the relations of the bladder when we study the reproductive system, but it's so clear here that in this mid-sagittal section that the bladder is located posterior to the pubic symphysis. It is in the pelvis and only extends into the abdomen when it is filled with the urine. It is in the pelvis and it is located anterior to the vagina, inferior to the uterus. And in the male, again, it is in the pelvis and it's behind the pubic symphysis here, but it is located anterior to the rectum. Here, the vagina separates between the bladder and the rectum in the female. Now look at the inside. It is lined with transitional epithelium, and the mucous membrane here is folded. Again, there are folds, rugae. These folds appear when the bladder is empty, but when the bladder is distended, the folds will disappear, like something like the rugae of the stomach, but of course, it's not exactly the same, but it's the same idea. And then there is a region here which is called the trigone of the bladder. Trigone because it has three angles. The two angles here at the base of the trigone, they receive the openings of the ureter, and then the angle here at the apex of the triangle is the beginning of the urethra. We call it the internal urethral meatus. Okay, and that's why it's called the trigone. Now the feature of this trigone is that the mucous membrane is firmly adherent to the underlying muscle fibers, and so it cannot be folded on itself. It's smooth, whether the bladder is distended or empty. In both situations, it's smooth. It does not stretch like the remaining part of the urinary bladder. They call it the trigone. This trigone can easily be identified when you do what we call cystoscopy. You pass a tube to the urinary bladder, cystoscope, to see what is inside the urinary bladder. And here again we have the mucosa, which is transitional epithelium, and then we have the muscularis layer. You see multiple layers of smooth muscle fibers in different directions. Here we don't need peristalsis. That's why we have them in multiple directions. We need what we call mass contraction. The bladder doesn't undergo peristalsis. There is mass contraction of the bladder. And these muscles, they have a special name. Keep it in mind. They are called detrusor muscle fibers. Detrusor, smooth muscle. They are just a smooth muscle in the wall of the urinary bladder. They are called detrusor muscle fibers, and we have the adventitia as well. In some places, it's covered by peritoneum. In other places, it is not covered by peritoneum. And this is the internal urethral sphincter, as I mentioned. It is at the apex of the trigone of the urinary bladder. And then we have the urethra. This is the female urethra. Female urethra is very short. It's 4 centimeters in length. It is straight and ends at the external urethral orifice or external urethral meatus. We're going to talk about this opening when we deal with the female external genital organs next week. The important thing here is that this urethra is short, it is straight, and that's why it is easily catheterized. So catheterization, urethral catheterization, passing a tube, a plastic tube, through the urethra in order to drain urine collected in the urinary bladder for many reasons. This is called catheterization, urethral catheterization. This is how urination takes place. When the bladder is distended, then there will be impulses sent by the parasympathetic nervous system to spinal cord segments S2, 3, and 4. And if the circumstances are favorable, then the reflex arc will continue through these nerves and will cause contraction of the smooth muscle fibers of the urinary bladder and relaxation of the internal sphincter. And if the circumstances are not favorable, then we have an external sphincter here of the urethra, which is made of skeletal muscle fibers. As the urethra passes through the perineum, it is surrounded by muscle fibers called sphincter urethrae. And these are skeletal muscle fibers, and it is under our voluntary control. I'm sure that you use it every day when circumstances are not favorable for urination. Here you are, the difference between male and female urethra. Look at the male urethra. It is long, it's about 20 centimeter in length. It starts here from the urinary bladder, internal urethral meatus, and has to pass through the prostate. So it has a part which is called the prostatic urethra. We're going to deal with the prostate next time. And then goes through the perineum, membranous urethra, where it is surrounded by that sphincter, external urethral sphincter, and then goes into the penis, which is called penile urethra, and opens at the external urethral meatus. It is long, it is not straight, and that's why the catheterization in the male is much more difficult than in the female. The narrowest part of this urethra is the external urethral meatus, whether in the female or in the male. So any catheter, because catheters are of different sizes, any catheter that can pass through the external urethral meatus, then it will pass through the remaining part of the urethra if the urethra was normal. Sometimes there is narrowing of the urethra, that's why they pass a catheter. But if the urethra is normal and you need to catheterize a patient, for example, a patient after operation, for example, is not ambulant, you need to catheterize in order to collect the urine, then the catheter that passes through the external urethral meatus, the caliber of that catheter will surely pass through the remaining part of the normal urethra. And it is held in position, as probably you can see it here, how it is held. Yeah, that's how it's held in position. See, they will inflate a balloon just before the tip. They are not inflating with air, blowing air here. No, they inject saline through the small tube which is in the catheter, and then this will be fixed here in position, and these are the openings through which the urine is going to drain. This is to show you a cystoscope. You can see that this is a fiber optic flexible cystoscope passing through the urethra, and they can see the inside of the urinary bladder. They can, even if there is any suspicious thing in the urinary bladder, they can remove it.